Did you know that aspirin, such a simple and accessible medication, can be a powerful ally for the health of your arteries? If you're experiencing pain, fatigue, or difficulty moving, especially in your daily routine, it might be time to explore a practical and safe solution to improve your quality of life. In this video, we'll show how aspirin can help unclog arteries, reducing pain and enhancing mobility, all in a simple and effective way. If you're someone seeking more energy, wanting to live with less discomfort, and aiming for movements free of pain, this video is for you. Step by step, we'll understand how this affordable solution can transform your well-being. Stay with us until the end to discover how aspirin can be a key to a more active life without limitations. When we think of cardiovascular health, the first thing that comes to mind is the heart. But the true key to a healthy heart lies in keeping your arteries in good condition. Arteries are responsible for carrying oxygen-rich blood to every part of the body. When they become clogged, this vital process is compromised. The primary cause of arterial blockage is atherosclerosis, a condition where fatty deposits, cholesterol, and other substances build up on the walls of the arteries, hindering blood flow. This buildup is often associated with LDL cholesterol, commonly known as bad cholesterol. Over time, these deposits narrow the arteries, leading to a range of issues such as shortness of breath, chest pain, and even heart attacks and strokes. For many people, arterial blockage begins silently and progressively. You may not notice any symptoms until the blockage becomes severe enough to significantly affect blood circulation. When this happens, even simple tasks like walking or climbing stairs can become challenging. This directly impacts quality of life, particularly for individuals over 40 who start to notice these difficulties in their daily lives. The good news is that identifying these problems early allows you to take action to prevent or at least minimize their effects. It's essential to understand how clogged arteries affect not only your physical health, but also your freedom and overall well-being. The solution to this problem might be simpler than you think, and that's exactly what we're going to explore next. Now that we understand the importance of keeping arteries open and functioning properly, let's focus on one of the main villains of cardiovascular health: cholesterol. Cholesterol is a fatty substance that the body uses for various essential functions, such as producing hormones and building cell membranes. However, not all cholesterol is the same, and the balance between its types can be the key to avoiding arterial blockages. There are essentially two types of cholesterol: LDL, low-density lipoprotein, and HDL, high-density lipoprotein. LDL is often called bad cholesterol because, in excess, it accumulates on artery walls, forming the dreaded fatty plaques. HDL, on the other hand, is the good cholesterol because it helps remove excess LDL from the bloodstream, transporting it back to the liver, where it is processed and eliminated. When LDL levels become elevated, it begins to deposit in the arteries, causing narrowing and blockage of blood vessels. Over time, this blockage can hinder blood flow, increasing the risk of serious heart problems such as heart attacks and strokes. Additionally, this cholesterol buildup can cause inflammation in the arteries, further worsening the condition. Factors contributing to high LDL levels include a diet rich in saturated and trans fats, lack of physical activity, obesity, and even genetic predisposition. With aging, cholesterol levels tend to naturally increase, making it even more important to monitor your cholesterol levels, especially after the age of 40, and find ways to control them to reduce the risk of cardiovascular diseases. Now that you better understand cholesterol's role in arterial blockage, you might be wondering, how can I control this problem? The answer may be simpler than you think and involves an affordable and effective solution that we'll explore next. Let's talk about a simple, effective, and accessible solution: aspirin. You've likely heard of aspirin, especially for relieving headaches or fever. However, aspirin has a much deeper and more important impact on cardiovascular health, particularly when it comes to preventing and treating heart conditions. Aspirin works primarily as an anticoagulant, meaning it helps prevent blood from clotting. This effect is crucial for preventing the formation of clots in the arteries, which are responsible for blocking blood vessels. By reducing the blood's ability to clot, aspirin helps keep arteries open and facilitates blood circulation. Additionally, aspirin has anti-inflammatory properties that can reduce inflammation in the arteries, thereby minimizing the risk of severe complications. Scientific studies show that aspirin can be effective in preventing heart problems in people at increased risk, such as those with a history of cardiovascular diseases or high cholesterol. It helps prevent arterial narrowing, significantly reducing the risk of heart attacks or strokes. Aspirin is so powerful because it directly acts on the mechanism of plaque and clot formation, interrupting this cycle and allowing blood to flow more freely. While aspirin is an accessible and efficient solution, it's important to remember that it is not a standalone treatment. It should be part of a broader health plan, which includes lifestyle changes such as a healthy diet, regular exercise, and stress management. Combined with these habits, aspirin can have a significant impact on your arterial health and overall well-being. If you're wondering how exactly to start using aspirin to combat arterial blockage, don't worry. In the next section, we'll explore how to do this safely and effectively. Although aspirin is an effective solution to prevent arterial blockage and protect your cardiovascular health, it's essential to use it properly and safely. Many people may be tempted to start taking aspirin without proper medical guidance, especially after hearing about its benefits. However, like any medication, aspirin has its contraindications and should be used with caution. Before starting regular aspirin use, it's crucial to consult your doctor. The healthcare professional can assess your medical history, pre-existing conditions, and other factors that may influence the decision. For example, if you have a history of gastric ulcers, bleeding issues, or clotting disorders, aspirin may not be the safest option for you, as it can increase the risk of internal bleeding. Additionally, the correct dosage is vital. The standard aspirin dose for preventing cardiovascular diseases usually ranges from 75 milligrams to 100 milligrams per day, but your doctor may adjust the dosage based on your specific needs. Taking more than the recommended dose can increase the risk of side effects, such as bleeding or stomach ulcers. Therefore, never take aspirin in higher doses than recommended without a healthcare professional's supervision. Another important point is the right time to take aspirin. Ideally, it should be taken with food to reduce gastric irritation. Also, if you're taking other medications, such as anticoagulants or anti-inflammatory drugs, it's essential to inform your doctor to avoid harmful drug interactions. Although aspirin is an excellent ally for your arterial health, it's important to remember that it shouldn't be used indiscriminately. Responsible use under medical guidance is the key to ensuring you get the benefits without unnecessary risks. Now that you know how to use aspirin safely, let's talk about how to combine it with a healthy lifestyle to maximize its effects and ensure long-term arterial health. Although aspirin is a powerful ally in maintaining healthy arteries, it should not be seen as a standalone solution. For it to be truly effective and provide lasting benefits, it's crucial to combine it with a healthy lifestyle, which includes a balanced diet, regular physical activity, and reducing risk factors such as stress and smoking. Healthy diet * maintaining a balanced diet is one of the pillars of cardiovascular health. Foods rich in saturated and trans fats, such as fried foods, fast food, and processed products, directly contribute to increased LDL cholesterol, bad cholesterol, levels and can aggravate the process of arterial blockage. On the other hand, a diet rich in fiber, fruits, vegetables, whole grains, omega-3 rich fish, and olive oil can help reduce cholesterol levels and improve heart health. Additionally, controlling salt and sugar intake is also crucial to maintain blood pressure, another important factor in preventing heart disease. Combining aspirin with a nutrient-rich diet will strengthen your arteries' health and optimize the medication's effects. Physical activity * regular physical activity is another key component in maintaining healthy arteries. Exercise helps control cholesterol, improves blood circulation, and strengthens the heart. Furthermore, regular activities such as walking, swimming, or even yoga can help maintain a healthy weight, reduce stress, and boost cardiovascular endurance. The general recommendation is to aim for at least 150 minutes of moderate exercise per week, which equals about 30 minutes, 5 times a week. If you're just starting, don't worry. Begin slowly and gradually increase the intensity and duration of your exercise as your body adapts. Stress reduction and healthy habits * chronic stress is a significant risk factor for heart problems as it can raise blood pressure and promote inflammation in the body, contributing to arterial blockage. Finding ways to manage stress, such as through meditation, deep breathing, or enjoyable hobbies, can have a significant impact on your arterial health. Moreover, quitting smoking and moderating alcohol consumption are lifestyle changes that can make a big difference to cardiovascular health. Smoking, for example, is one of the biggest enemies of the cardiovascular system as it damages the arteries and increases the risk of heart disease. With these healthy habits in mind, you will enhance the effects of aspirin and create an effective preventive regimen for your heart and artery health. Now that you know how to adopt a healthy lifestyle, let's explore some real-life examples of people who saw significant improvements in their cardiovascular health after adopting this regimen, including the use of aspirin. Now that you understand the benefits of aspirin and how it can be combined with a healthy lifestyle, it's time to see how this works in practice. There are many stories of people who, after adopting aspirin use and lifestyle changes, significantly improved their cardiovascular health, prevented serious complications, and regained their quality of life. For example, Maria, a 62-year-old woman, had always maintained a relatively healthy lifestyle, but she started experiencing chest pains and excessive fatigue while doing simple activities like walking or climbing stairs. After a medical consultation, she was diagnosed with high cholesterol levels and an increased risk of heart disease. Her doctor recommended daily aspirin use, along with a more balanced diet and daily walks. Within a few months, Maria noticed a remarkable difference. Not only did her chest pain decrease, but she also regained the energy to perform her daily activities more easily. The control of her cholesterol, combined with aspirin use, helped clear her arteries and prevent more serious issues. She shares that she feels more energetic and has a sense of well-being she hadn't felt in a long time. Another example is Carlos, a 50-year-old man who, after a heart attack, was advised by doctors to adopt continuous aspirin use. Carlos also made adjustments to his diet and increased his physical activity. Over the years, with regular aspirin use and lifestyle changes, he managed to reduce his risk of future complications and significantly improved his cardiovascular health. These are just two examples, but there are countless reports of people who benefited from combining aspirin with a healthy lifestyle. For many, this not only means preventing heart disease, but also reducing symptoms like leg pain and limited mobility, which are common in those with blocked arteries. Aspirin, when used correctly and combined with healthy habits, can truly transform the lives of people with cardiovascular issues. Change is possible, and many people are already experiencing the benefits of this approach. If you're wondering how you can achieve these results in your own life, the next step is simple. Adopt the strategies we've discussed here and seek medical guidance. Now that you've seen how aspirin can be effective in many people's lives, let's review the key points to keep in mind when applying this knowledge to your own health. Now that you have all the information on how aspirin can help protect your arteries, improve your cardiovascular health, and even prevent serious complications, it's important to review the main points to ensure you're ready to apply this knowledge effectively to your life. First, we understand the problem of blocked arteries and how elevated cholesterol, particularly LDL, the bad cholesterol, contributes to narrowing and blocking the arteries. This can lead to serious complications, such as heart attacks and strokes. Therefore, it's crucial to maintain strict control over your cholesterol levels and heart health. Aspirin, with its anticoagulant and anti-inflammatory properties, has proven to be a powerful tool in combating artery blockages. It helps reduce the risk of blood clots and keeps the arteries open, allowing blood to flow more easily. However, aspirin should be used with caution and under medical supervision, as, like any medication, it has contraindications and should be taken at the correct dosage. When combined with a healthy lifestyle, including a balanced diet, regular exercise, and stress reduction, aspirin becomes a key part of an effective preventive plan for cardiovascular health. Lifestyle changes such as quitting smoking, controlling alcohol intake, and managing blood pressure can further enhance aspirin's effects. Looking at real-life examples of people who successfully used aspirin, it is clear that when used correctly, this simple medication can help significantly improve the health of your arteries and your quality of life. Stories like Maria's and Carlos's are proof that combining aspirin with healthy habits can transform lives. Now that you have a complete understanding of how aspirin can be used to clear your arteries and improve your cardiovascular health, the next step is to talk to your doctor. They can guide you on how to integrate aspirin into your health regimen safely and effectively, taking into account your individual needs. Remember, the health of your arteries is an investment in your future. By taking preventive steps now, you are paving the way for a longer, healthier, and limitation-free life. Don't wait until tomorrow to start what you can begin today. Your health is worth every effort. Now that you have a clear understanding of how aspirin can help improve your artery health, clear your blood vessels, and even prevent serious complications, It's time to take control of your health and take action. Remember, heart and artery health should not be viewed as an isolated issue, but rather as part of an ongoing commitment to overall well-being. The use of aspirin, combined with a healthy diet, regular exercise, and the management of risk factors such as stress and high cholesterol, can be a significant step toward a healthier and more active life. Now, imagine the positive impact these changes can have on your daily routine. The relief from symptoms such as shortness of breath, leg pain, and extreme fatigue. The possibility of enjoying simple activities like walking with friends, climbing stairs without pain, or even taking a walk in the park without the constant worry that your arteries aren't functioning well. All of this is possible, and you can start today. By consulting your doctor and starting this lifestyle change, you are building a solid foundation for a healthier future. It's not just about preventing serious diseases in the future, but about living well in the present. Quality of life is within your reach, and aspirin, when used correctly, can be a powerful ally on this journey. If you enjoyed this content and want to learn more about how to improve your cardiovascular health or other topics related to well-being, don't forget to subscribe to the channel and turn on notifications. We are here to help you achieve your health and quality of life goals. Join us on this journey of care and prevention. Now you have the tools to take action. Make the right decisions and take care of your health with confidence. Your journey to a healthier life starts with the first step, and that step can be taken today.